If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically if you experience the full sensation of climax, but without the expected release of seminal fluid, this message is incredibly important for you. Maybe it happened just once, sparking a sudden knot of worry in your stomach, or perhaps it's been a recurring concern you've quietly carried alone, tinged with embarrassment or fear about what it could mean for your health. First and foremost, I want you to understand this. What you're experiencing is not a sign that your masculinity has diminished, nor does it mean your intimate life is over. In fact, it's not a failure at all. Think about it. But here's the thing. The most powerful tool you have for your sexual health isn't at the pharmacy. It's probably sitting in your hallway right now inside a pair of sneakers you haven't touched in months. I'm Dr. Emma Blake, and today I want to talk about a study that frankly doesn't get nearly enough attention. Of it as your body sending a precise, informative signal that simply needs to be understood. I'm Dr. Eliza, and today we're going to explore this topic thoroughly. We'll cover how ejaculation normally works, the critical difference between climax and ejaculation that many men overlook, the 3 most common causes of what's called dry ejaculation, and finally, the situations that require immediate medical attention, along with a clear, actionable plan to restore your confidence and peace of mind. Let's begin with the basics. Consider your reproductive system as a finely tuned orchestra. The testicles produce sperm, the seminal vesicles contribute most of the nourishing fluid, and the prostate adds a protective, enzymatic component. All of these elements combine in the urethra to form the fluid mixture that is expelled during ejaculation. At climax, a precisely timed sequence of muscle contractions propels this mixture outward. This happens in fractions of a second, orchestrated by a delicate interaction of nerves, muscles, and glands. Here's an essential point that is often misunderstood. Climax and ejaculation are not the same. Climax is the neurological experience of intense pleasure, while ejaculation is the physical release of fluid. Typically, these events occur together seamlessly, but they are governed by different mechanisms. Dry ejaculation occurs when a man reaches climax, experiences that familiar peak of pleasure, but notices little or no fluid being released. It's sometimes described as an empty orgasm. While this can feel alarming, it's important to understand that the pleasure is still intact. It's the mechanical delivery system that has changed. Your virility, desire, and ability to experience pleasure remain functional. Understanding the cause is the key to addressing it. There are 3 primary reasons for dry ejaculation. The first is what I call a relaxed gatekeeper, known medically as retrograde ejaculation. Imagine a small valve at the exit of your bladder designed to prevent fluid from flowing backward. During ejaculation, this valve should close tightly, directing the fluid forward. If it remains too relaxed, the fluid takes the path of least resistance and flows into the bladder. You still feel the full intensity of climax, but there is little to no fluid expelled. A common clue is noticing cloudier urine after intimacy. Retrograde ejaculation can occur after prostate or bladder surgery due to nerve changes, or as a side effect of certain medications used to manage high blood pressure or an enlarged prostate. Understanding that this is a mechanical alteration rather than a loss of sexual function can bring immense relief. The second cause is blocked plumbing, or ductal obstruction. In this scenario, the glands are producing fluid normally, but the ducts that transport it become partially or fully blocked. Causes can include scarring from past infections, such as prostatitis or small calcifications forming within the ducts. Symptoms may be subtle, sometimes mild pelvic discomfort during climax, or a gradual decrease in fluid volume over time. The encouraging news is that many of these obstructions can be treated with medication to reduce inflammation or minimally invasive procedures to restore normal flow. The third major cause is low hormonal fuel, specifically low testosterone. Testosterone is crucial not just for sexual desire and sperm production, but also for the optimal functioning of the prostate and seminal vesicles. When levels drop, the system slows down. This may initially show as reduced fluid during climax, but over time, other symptoms often appear, including decreased libido, weaker erections, less intense orgasms, fatigue, mood changes, and even loss of muscle mass. Low testosterone, also called hypogonadism, is a treatable condition. Blood tests can confirm the deficiency, and carefully managed hormone therapy often restores fluid production, energy, and sexual function. It's important not to dismiss these changes as simply getting older. While most cases are manageable, dry ejaculation can sometimes signal a more serious underlying issue. Seek medical attention promptly if it occurs suddenly without explanation, particularly if accompanied by pain, blood in the urine, fever, or loss of sensation in the genital area. Neurological conditions, long-standing uncontrolled diabetes, or rare urological cancers can interfere with normal nerve and gland function, making timely evaluation essential. Beyond the physical changes, dry ejaculation can take a significant emotional toll. Many men equate the presence of fluid with their performance and masculinity, and when it disappears, feelings of inadequacy, anxiety, and frustration can emerge. Some men even begin avoiding intimacy to protect themselves from perceived judgment. Knowledge and open communication are the first steps to overcoming this. Understanding that this is a physiological change rather than a personal failure can lift a tremendous burden. Pleasure, erections, and connection with your partner are not solely dependent on fluid release. Your intimate life can remain fulfilling and joyful. Here's the bottom line. The absence of ejaculation is not the end of your intimate life, nor does it define your masculinity. It's your body signaling a specific change, one that can be investigated and often treated. Identifying whether the cause is retrograde ejaculation, ductal obstruction, or low testosterone allows you to take actionable steps toward relief and reassurance. Start today by consulting a urologist for a straightforward evaluation, including history, physical exam, and blood or urine tests. Manage underlying conditions like diabetes, high blood pressure, or cholesterol, which impact vascular and nerve health. Discuss your experiences openly with your partner and your healthcare provider, and take comfort in the knowledge that solutions exist. Once you understand the cause and receive a clear diagnosis and plan, the worry will naturally begin to lift. Beyond the immediate causes, it's helpful to consider the broader context of male reproductive health and aging. The male reproductive system is influenced by an intricate interplay of hormones, nerves, blood vessels, and lifestyle factors. For example, cardiovascular health directly impacts erectile function and fluid transport, as the penile and prostate blood supply is highly sensitive to arterial health. Maintaining regular exercise, a balanced diet, and healthy sleep patterns supports optimal blood flow and hormone balance. Similarly, chronic stress can alter nervous system function, affecting both climax and ejaculation. Stress management techniques, including mindfulness, meditation, and controlled breathing, have been shown to improve sexual function in many men. Nutrition also plays a subtle but meaningful role. Adequate intake of zinc, vitamin D, and omega-3 fatty acids supports hormone production, while excessive alcohol or recreational drug use can interfere with nerve signaling and hormone balance. Hydration, too, matters. Fluid production relies on overall hydration status, as seminal fluid is composed largely of water, along with nutrients, proteins, and enzymes. Medical advances in men's health now provide a wider array of solutions than ever before. For retrograde ejaculation, some medications can help tighten the bladder neck valve, allowing fluid to flow normally again. For ductal obstruction, minimally invasive endoscopic procedures can remove blockages or improve flow. Low testosterone therapy, when carefully monitored, can restore reproductive system function, improve mood, increase muscle mass, and boost energy levels. In each scenario, early intervention is key, which is why timely medical consultation cannot be overstated. Finally, the psychological component is critical. Understanding the physiology behind dry ejaculation allows men to reframe their experience, reducing anxiety and restoring confidence. Sexual health is not only a physical process, it's a combination of physiological, emotional, and relational factors. Open communication with your partner fosters intimacy and reduces the isolation many men feel when facing these changes. Support networks, including men's health forums and educational resources, offer reassurance and practical guidance, reinforcing that these experiences are common and manageable. In summary, experiencing dry ejaculation is not a personal failing. It is a signal from your body that can be understood, investigated, and addressed. Whether the cause is a relaxed bladder valve, a blocked duct, or low testosterone, actionable solutions exist. Take control by seeking medical evaluation, maintaining cardiovascular and hormonal health, nurturing psychological well-being, and communicating openly. With proper understanding and support, your intimate life can remain vibrant and satisfying, no matter your age. Knowledge, early action, and self-care are the tools that transform concern into confidence, ensuring that your sexual health remains a source of connection, pleasure, and vitality well into later decades.